asthma gets worsened with air pollution. Every year, people come with increase in symptoms, and we have to increase their drugs to make them relief.
ये मौसम में हल्का सा सांस लेने में दिक्कत है, आँख में जलन जैसा होता है हल्का से.
Wearing the mask also, it is not getting prevented actually. Yesterday I got this asthma attack again.
In the last 2 weeks, Delhi's escalating pollution levels have kept pulmonologists busy as they see an increase in the number of patients grappling with asthma and respiratory challenges.
Last year, the same season I suffered, I had to be admitted here. Because in initial stage, I did not take it seriously. So then I had to be admitted here 7 days.
So, what precautions can we take?
Today we are in the OPD of Indraprastha Apollo Hospital with Dr. Chawla, and we've spoken to a few patients who have had worsening symptoms because of the rising pollution. We will talk with Dr. Chawla about what he's seeing in the OPD and what can be done to protect yourself from pollution. So, sir, if you could tell us a little bit about what is happening in your OPD right now from the last, say, 2 weeks or so.
Mostly people who are already suffering from asthma, chronic obstructive lung disease, or chronic interstitial disease, they are coming with acute exacerbation. That means acute attack. And the COPD directly also occurs because of the air pollution in India. 50% of the COPD patients are because of the air pollution, and asthma gets worsened with air pollution. Every year, people come with increase in symptoms, and we have to increase their drugs to make them relief. And then they have to restrict indoors so that they are not exposed further. It's every year for last many years in the month of October and November, which is more. Otherwise also it is affecting, but I think the number increases during this season. And when it occurs, I think the instruction to people is that don't go out if it is not very necessary. Remain indoors. Don't go for morning walk. If you are really very keen, probably 3 to 4 is the time when pollution is the least during daytime, and you can go for a walk. Wear mask, probably the N95. That would be take lot of fluids, lot of fresh fruits, because all these wear zero power spectacles, because the eyes, they get dry when you are exposed to the air pollution. And if you are a patient, then air purifier might help, but otherwise normally air purifier is really not recommended that for a common healthy individuals, because you're going out, so naturally when you go out you are again exposed, so it really doesn't help. But if person is remaining indoor, then they can have, because AQI in that room will definitely go down once they have, because it absorbs almost 99% of the dust, pollens, and viral particles present, fungal, in that room. So these are the things one can do. And when you reach home from the work, wash your face, wash your eyes, because eyes, you need to remove all the dust particles, and also wash your face as well, because it also collects a lot of dust. So you can only prevent some of the side effects, but if you're staying in the city of Delhi and around, you will anyway be exposed to high AQI in this season.
And so what happens, what is the long-term effect of staying exposed to these high levels of pollution for, like you said, people of Delhi?
No, high level, I told you, COPD, 50% of COPD is because of air pollution. 29% of the lung cancer death are because of air pollution. Chronic lung diseases, patient with a coronary artery disease, stroke, ischemic stroke is also related to air pollution. So all these effects can occur.